how it can affect the health system, how it can affect the medicine, it is maybe a question for you. But I'll tell you how we see the future of the innovation system and R&D system in Croatia. So why should state invest in R&D and innovation? Why we need at all the public support for this? Why don't we let to the market? So in a crisis, in how the Croatia is now, there are some estimates. I would like for Minister of Finance to hear this, but there are some estimates that OECD made that increase in by 0.1% could raise GDP by about 1.2% in long run. The special tailor-made study for Croatia made by World Bank predicted that if we raise the R&D investments to 3%, we can raise the GDP by 5.8% by 2025. So this is actually the estimates which can be a good reference for the choice of growth strategy for Croatia. So for example, I don't know much about this, but you know if I'm right or not, but the life cycle of biotechnology company from research to commercialization is 8 to 12 years, and without state aid, without seed capital, venture capital in Croatia, it is impossible to develop such products that will compete the global market. Also, Professor Vukičević told us earlier. So that's why we need public investments in the development of the innovation cycle in pharmaceutical company, in any sector. We need from the research, technological development stage, early stage of commercialization, and to the production. We need a lot of time, a lot of money, a lot of proficiency, and here is where actually the agency like ours, like BICRO, should come and help the market. So a few data more about Croatia, and here are the reasons why we need to increase the public support to innovation. Our total investments in R&D are about 0.8%. It is terribly low comparing to the not European countries, also to the new European countries. And from this, it is only 40% of the total R&D from private sector. From public sector research from universities, they are not much been commercialized. Also shows the data Professor Vukičević told us about the patents. And there is a considerable process of brain drain, which affects the Croatia's pool of human resources. We have also a big problem with the efficient management of the public research system, about the management of universities and institutes. But we have to set the goals, we have to move forward, and in ministry and the BICRO we told us we have to build a global image as a small country for great innovations. This is, I will give the example of Estonia. In ICT investors are they like Estonia because of one product which was successful, it is Skype. And if we succeed, for instance, in ICT to have such product, I think the all sector would benefit from it. And I think we can achieve this by 2020. We have to facilitate access for private sector to public funding for R&D. That's what all countries in Europe do without bureaucratic burdens, on competitive basis and in the amount the private sector needs. To improve research excellence, which is very important, and at universities and institutes, and also technology transfer. We have to work more on the education system. We have to train and recruit more and more highly skilled engineers, scientists, and because this is the basis for innovative Croatia. And infrastructure, this is also conditio sine qua non for innovation system development. Our Business Innovation Agency, our goals are to implement national policy measures, and financial instruments in the amount the government is giving us the money. We have to foster and strengthen R&D activities in public sector and link it with entrepreneurs. And very important issue for us is the structural funds, because I see it as the only envisaged way to increase investments, and we have to use it in R&D and the I sector, particularly in private companies. Our goal is also to develop and maintain education and networking activities and to help scientists and innovators to access the finance in European Union and also in Croatia. We have a set of financial instruments. We are developing new. There are maybe some of you know these programs for startup and development of the new technology-based companies, programs for fostering entrepreneurship developed on R&D results, financial instruments for technology transfers and for innovation infrastructure. We work much on the risk capital development support. In next year there will be, by the help of the European Union, will be the pretty big venture capital fund available for companies in Western Balkan states. This means ex-Yugoslavia minus Slovenia plus Albania. But I think that Croatia has the biggest chance to benefit from this fund. It will be 140 million euros only for this area, for this region. Also important thing is the state aid for R&D. This is what big companies and their branches for R&D use in Croatia. We have very beneficiary tax aid, profit tax aid for R&D, and our goal should be to transform existing sectoral state aid, which is very huge in some sectors, in transport, in agriculture, in shipbuilding, from traditional industries to support R&D in these industries. So example of what we are doing is the brand new project, the contracts for which have been signed this month. It is the Biocenter, the technological incubator which will be built in Zagreb in future university campus site, worth 16 million euros. It should be its aim will be to catalyze relationship between basic and applied research in biotechnology. It will offer necessary infrastructural prerequisites for developing entrepreneurship in the biosciences field. Target groups for this biocenter incubator will be startups in the biosciences field, and the premises there are 4,500 square meters, and the central laboratory will be there, and it will be designed for developing new production processes involving bioproducts in compliance with GMP. So main challenges for Croatia stay that we have to scale up incentives for R&D that will enable the transformation of the innovative ideas into business results. We have to stabilize the funding for the R&D and stabilize also the institutions and programs. We have to develop targeted public investment for R&D and to create, which can help to create new boost for national economy, but also to foster knowledge-intensive FDI, where we see the international companies to open the to research labs in Croatia. We have few very successful examples in Croatia, and also in pharma industry. We have to use the EU funds, which will be available, but to systematically link it with national funds, not to have it on two different tracks. And this is the great challenge for administration. And to use these increased funding from EU resources to facilitate the urgent reform we need in the governance of our research institutions. And what is, I think, very important to link sectoral state aid we have for funding innovation, and to use the expected wave of regulation in state aid to drive innovation. So this is from me, and thank you for listening.
So now we have, let's go immediately to questions. Tougher they are, better they are, because then we will not sleep. So if you can attack someone, it's great.
This is not an attack. Pitanje na engleskom ili na hrvatskom?
Kako god hoćeš.
Za doktora Lichtenberga jedno pitanje. Ako može elaborirati svoj zaključak da je upravo proporcionalan odnos broja registriranih lijekova u državi i produženja života. To je donekle u kontradikciji sa prethodnim zaključkom njegovim, da zemlje u kojima se više koriste novi lijekovi dobiva se više na godini života. Naime, zanima me kako po definiciji mi se čini da je normalno da zemlje koje imaju više registriranih lijekova da to implicira i velik broj generičkih lijekova. Jer znamo da je ograničen broj novih lijekova koji se registriraju. Pa mi se čini onda da je to u kontradikciji jer je jako teško ponderirati onda utjecaj veće dostupnosti lijekova u zemljama gdje je više lijekova registrirano u odnosu na utjecaj koji imaju novi lijekovi. I onda imam malo problem sa konceptom jer svi stari lijekovi su jedno bili isto tako novi lijekovi.
To je bio profesor Francetić. This was Igor Francetić, who is the head of clinical pharmacology at the School of Medicine. This was question to Frank. You got the translation?
Yes. I don't think there's really a contradiction. The way that I define the number of drugs would be the number of molecular entities, the number of molecules. And so I'm not counting if there are like generic and branded, I would only count that as one. And I think that's a second best measure of innovation. I do think that actually vintage is better because even though a drug may be registered in a country, it may be that hardly anyone is using it. And so I showed you the comparative data on cardiovascular drugs. And what really matters is utilization, not merely the presence on the market. So I think that is a better indicator. But in any case, when I do measure the number of drugs, I'm measuring the number of molecules, not the number of manufacturers.
Okay. You want to comment, Igor? Okay. You will discuss this privately.
Yes.
Dalje. With the guns. Yeah. Dalje, izvolite. Siniša, izvolite. Evo tu.
Hello, for Dr. Lichtenberg, Lichtenberg, another question. As the population is getting older, we have more and more comorbidities. As we have more and more comorbidities, we have more and more polypragmasia. More and more, it's a term in Croatia, I think it's the same in English, where one person is taking 5, 10, 15, and in Croatia we have evidence of one person who's actually taking 50 drugs in one day. And we're pretty much surprised that he's still alive. How do you comment this in light of new drugs coming in, and as you advocate more use of new drugs, their interactions aren't really evidence-based right now, as they are new, of course. And what is the reality of a thalidomide type of thing coming up in the near future?
I can stay.